aging conference in Charlotte today, so I think that probably will impact
Hmm.
some attendance today.
Oh yeah. What
Yeah.
was what's the one down there?
They have a big annual aging conference, and because
Uh-huh.
of COVID, it's been Zoom the last couple of years. So this is the first time they've had it in person in a couple of years, and I know
Okay.
they've got over 300 people registered. So
Oh
Hmm.
it's a
yeah.
big.
Who's the host?
The Area Agency on Aging, Central Iowa
Oh, all
Council of
right. Yeah.
Governments, Area Agency on Aging down there.
That must be the only thing of its type in the state. That's the first animal like that I've heard of.
Yeah, actually, a lot of regions have them.
Oh yeah.
This
Oh.
is probably the largest one. Yeah.
Hmm.
Well, good to see a variety of folks on. Good morning, everybody. It's like people are coming on gradually. Good morning.
Good morning.
Suzanne, I assume you aren't in San Francisco. Shaking her head. Yes, got the Golden Gate Bridge behind her. Interesting. Did all of you get the announcement about this meeting? We've had a couple of inquiries last couple of days from folks saying they didn't get the announcement or a reminder about it. So,
Hey Mary, I got mine. Can you hear me okay?
yeah, we certainly. Is that Jill?
It is. It's Jill, and it looks like Secretary Singh-Bai has joined us as well.
Exactly. Yep. So I think we're ready to go here. We'll give it another minute or so. Looks like people are kind of coming on. Okay, about 30 more seconds and then we'll get started. Good morning, Dr. Singh. We'll get a formal introduction here. So good to see you.
It's good to see you. Thank you for having me.
Well, it's a beautiful day out. I hope you guys get out and enjoy it this afternoon after our meeting. Well, let's do get started. So, good morning, everybody. I'm Mary Bethel, board chair for the Coalition on Aging. We appreciate you being here today. It's a beautiful day out in North Carolina. So, thank you for spending your Friday morning with us today. I see that our guest is already here, so we're just going to hop right in and hear from him. And Dr. Singh-Bai, if it's okay with you, what we thought we'd do is let you maybe chat a little bit first, and then if you're up to it, we'd do questions and from folks, if that's agreeable with you.
Yeah, that's perfectly fine with me.
Great, super. Well, as we mentioned, while we were waiting for folks to come online, we had a couple of inquiries and people saying they didn't get the meeting reminder. They let us know this morning, so I hope that all you guys did get it. It looks like a lot of you did. So you indicated earlier, so we're glad to hear that. We also know there's a big aging conference going on in Charlotte today with I think over 300 folks. So that I think will probably have a little bit of an impact on our attendance also. But we're certainly glad to have the Secretary of Health and Human Services with us today. And I'm going to call on Jill Zimmerman Lawrence, who is the Deputy Director for the Division of Aging. So Jill, I'll turn it over to you.
Thanks so much, Mary. Hey, everybody. It's great to be with you. Joyce Massey Smith sends her regrets. She's at a medical appointment that she couldn't get out of. It's really a pleasure to welcome and to introduce Secretary Singhbhai to all of you. Secretary Singhbhai is a family medicine physician and a professor at Duke University. He's also a member of the North Carolina Medical Board. Prior to his role with North Carolina Department of Health and Human Services, he served as president of Duke Regional Hospital and president of the North Carolina Medical Society. His work has focused on improving access, developing the healthcare workforce, and making care more efficient. Dr. Singhbhai is the first Indian American cabinet member to serve under a North Carolina governor. I'll say each time I've had the pleasure of meeting or listening to Secretary Singhbhai, I've been struck by his warmth and thoughtfulness. I got to ask Secretary Singhbhai a couple of questions in a meeting the first time I got to meet him. And as many of you know, he is very accomplished in the medical and in the academic world. But I asked him what he cared about most or what he was most proud of outside of his professional pursuits. And he said that his two kids were his biggest joy and what he was most proud of. And I really just thought that spoke to his holistic person. And it was really a pleasure to get to know him that day, both in the professional space as well as in his personal space. So I want to turn it over to you all. I think that his previous work has aligned so well with the work of the Coalition on Aging and the populations that we care about and are working towards. And I just really look forward to working with Secretary Singhbhai as a member of his team and look forward to all the great work that we're going to do together. So Secretary, I'll turn it over to you.
Great. And thank you, Mary, and thank you, Jill, for that very kind introduction. I'm really honored to be joining the coalition today. And it's great to see the number of increasing advocates that are joining the Zoom call. So, Mary, I'm not sure that Charlotte meeting's keeping people away. The number seems to be growing by the second.
Yeah.
You have all been doing really remarkable work to ensure that each person can age with dignity in their communities and their community of choice. And I'm eager to continue to carry that torch forward. I'm going to share a little bit of background I have with the aging community that many might not be familiar with. But it really starts with the recognition that we all know that North Carolina is getting older. I think the projections are saying we're going to have 1 million more older adults between 2022 and 2042. And as we anticipate this growth, we really need to build on the great work that's already being done to support our older adult population, including investing in things like infrastructure, workforce, and certainly the services that allow us to thrive. I took this job because I have a genuine desire to serve the state. North Carolina has been so great to me for the last 20 years. I felt professionally and personally this was an opportunity for me to give back. And I think one of the most important things that I've learned in my time as a physician is the importance of dignity and how important it is to respect individuals' dignity at the most basic level, as well as at the more macro level that sometimes it's harder to see. And I think about the challenges that individuals have. Nobody comes to those challenges wanting to be in that challenge space. People often find that as a result of circumstance or things beyond their control. And I think one of the most important things we have to do is respect individuals' dignity as they're processing whatever they're seeing. And I think that particularly applies to the aging community, just given the realities, as I said, of how many people are facing challenges and the number of challenges are not only increasing, but also, as I said, the number of individuals that we need to reach out to. So for 20 years, as Jill said, I've been a family physician. And in agency DHHS, we talk a lot about Medicaid, and certainly Medicaid is important with the aging community. But my experience actually comes from Medicare. And so one of the most important things that I've learned as we try to think about how we better serve the Medicare population for which I was responsible is thinking about all of the other things. What's going on at home, what's going on with infrastructure, what's going on with the community, what's going on with finances, and what's going on with this concept that I think is so well captured in all stages, all ages, reframing this concept of aging and what that really means. And I feel like the work of the coalition is as front and center on that. I've been a hospital administrator, and I see the challenges that our aging community faces in terms of not only accessing the hospital, but oftentimes discharging and leaving the hospital, which can be incredibly complicated and it can be fraught with a number of challenges that patients feel. And everything we see in one community is only magnified in rural communities, and in particular the Western North Carolina, given infrastructure challenges, challenges with people, and challenges with resources. So I was thrilled to learn about the number of services that we actually provide in HHS that's really designed to help individuals age in place, age gracefully, thrive as they age, and making sure that we provide those necessary resources that individuals need. And I know Jill and team can talk about the variety of services that we provide, everything from the services that we do on a day-to-day basis, right up to very specific services we provide for those who ultimately end up getting hospitalized at one of our state-run facilities. I am really excited about the All Ages, All Stages program, and I think that it really reflects where we need to go in North Carolina. So I'm committed to pushing for those policies that ensure that our older adults receive the care and support that they need to thrive. There are three areas that I have as priorities across the entire agency, and I think they make a lot of sense to this group. The first is really to build a sustainable workforce to ensure a healthier North Carolina. One of the challenges that I have witnessed multiple times are patients who are adult patients of aging adults, and those patients of mine whose a lot of time, effort, money, and resources is being spent trying to figure out how to take care of mom and dad as they age. So I'm very familiar with the realities that people face both as an older adult or individuals who are caregivers for older adults. I want to strengthen access to care in all North Carolina communities. We're 80% rural state, and I've been fortunate enough to be a part of the Triangle community for 20 years. But you don't have to travel far outside the Triangle to know that it can be pretty rural before you get to the next metropolitan areas. I want to maintain a strong Medicaid program that improves health and drives value. And in the end, really want to make sure all of our programs and services are working for all North Carolinians. I'm excited to work with the General Assembly as we move forward on several of these priorities. And I would be remiss if I didn't take a moment to thank Governor Stein for giving me the opportunity and entrusting me with this important responsibility. We have a lot of state leaders who want to make a difference. I think we're at a time where people know that if we don't invest properly, both financially as well as in terms of resources and with our time and effort, we run the risk of making current challenges and problems even worse. So I'm ready to roll up my sleeves and work with the team here on the call to figure out what we need to do. But that's how I see my role, working with the coalition and others at a very high level. I'm happy to answer any questions that you have, but really, this is about my opportunity to hear about what's on your minds as much as it is for me to share what's on mine. So, Mary, I'm going to stop there. And like I said, happy to take any questions.
Super. That's great. Well, you certainly came in at an interesting time. I tell you what, if you have a question, go ahead and raise your hand, and I will recognize folks. But I'll just ask one to get us started. So I know that everybody's kind of on pins and needles, wondering what's going to happen to federal funding. And I know the announcement came down this week that the department had lost, I think, $100 million in potential loss of 80 positions. I know you have no crystal ball about what's going to happen or anything, but I guess the department's making contingent plans as much as you can on things relative to that.
Yeah, Mary, thanks for bringing that up. Yeah, we learned on the 25th that a series of grants and programs had been canceled 24 hours prior. So this really took us by surprise. And it maybe in some ways shouldn't have taken us by surprise, just given the nature of things that are happening at the federal level. But nevertheless, identified that this is really anchored around many of the things that were born out of the pandemic. And I think it's important to state what was born out of the pandemic, because this is not about testing. This is not about laboratories. This is not about COVID PPE. There are a number of things that these grants were designed to do, everything from upgrading our lab down to providing grants to subrecipients who are doing the important work related to everything from surveillance and to other things around public health. So your question around, what are we doing? The first thing we're really trying to understand is what's impacted. Because these grants are so big and because they're braided with a number of other services, it's what we learned is it takes us time to really understand what is impacted. And then you're exactly right. Our goal will be to continue to figure out how to keep as many people as part of the agency. You know, we still have a 20% vacancy rate. And so the first thing we're focusing on is the people in the agency to make sure that anybody impacted, there's an opportunity and way for them to stay as part of the organization. And then looking at which programs are impacted. And because many of our programs are funded from various sources, the real challenge is to understand how much of a given program might be impacted by a grant. And then finally, one of the other challenges to actually understand is what is impacted versus not in terms of work that's already been done versus work that's already been encumbered or work that we anticipate or obligated to get done. So I think you're going to hear a little bit more from the agency as we move forward, but right now, most of our focus is really trying to figure out how we interpret and then respond to the type of messages we're getting from the federal government.
Right. And we would hope that would be the only funding cut that the state receives, but in likelihood, it's probably not, that's for sure.
Yeah. And I think, Mary, I should have said that, you know, part of what we'll have, I think as we get through this cycle, one of the things we're going to learn is a bit of a playbook. It's not the playbook that I wish we had, but we'll have a playbook on how to understand some of this stuff. I should also mention that one of the biggest challenges we have is anytime something has been signaled to the agency from the federal government, they're usually individuals and agency leaders we could turn to for certain guidance and interpretation. And because many of those individuals have also left those agencies, that interpretation has been very difficult. So in the past, if CMS sent a memo, we didn't understand, we had a CMS contact, they'd give us clarification, and then we can move on. Now, sometimes we get a little bit less than a memo. It's unclear exactly who is issuing the memo. We don't know whom to contact. If we guess whom we contact, it's not exactly clear if they're there or in that same role or they have any additional information to offer. And then finally, a lot of these things, they get changed as I think the federal government realizes the impact of either the way it's communicated or what's been impacted. So even this most recent round, we were told certain things are cut, and then we were planning around them being cut. And then 24 hours later, we were told that they're not cut, which is great, but at the same time creates a bit of a chaotic state in the agency when there's a lot of other things we'd like to invest our time and energy on.
Right. Well, I have lots of questions, but I'm not going to ask them. I want you to hear from folks who are on the call.
Sure.
So I see Tova Wax, you have your hand up, so go ahead.
Hello. Yeah, I'm Tova Wax, and I'm a retired psychologist and social worker who has worked with the deaf and hard of hearing community and have a special interest in elderly people and their issues. One of the questions I have is, with DEI being eroded or even destroyed, I'm wondering how you think that's going to impact on our population here in terms of people with, who are not only elderly, but also have disabilities, different races and cultures and religions and, sexual orientation, all the DEI issues. How do you think that's going to impact the services that we're going to be able to continue to get in North Carolina?
That's a really good question. There have been specific things that that the federal government, as you know, has signaled specifically around that topic. But my focus has been very simple. We're going to continue to put people first, focus on the work that needs to get done, and ensure that we're reaching out to our most vulnerable communities. It doesn't take long to recognize that we have such disparities of care just based on geography in terms of what your outcomes might be with respect to, are you being hospitalized for something, not get hospitalized for something. So we are focusing on putting people first. We have an Office of Rural Health, we have an Office of Minority Health, both are in statute that we need to continue to do work on. And so we're really focused on just making sure that we identify who needs our services and we're able to reach out to them.
Thank you. Okay, I see. And thank you, Tova, for introducing yourself and what you do. I think that's a good thing to do, is to let the secretary know who you're with if you're with an organization and what you do. So Lee Dobson, I think I saw your hand next.
Thank you, Mary. Lee Dobson. I actually wear two hats. I work for a nonprofit service provider, Beata Home Healthcare. We provide home and community-based services across the state of North Carolina as well as across the country. And then I also wear an advocacy hat. I work with Hearts for Home Care. It's a nonprofit advocacy organization for quality care in the home. So thank you for allowing me to ask a question. I really appreciate seeing you again. I echo Jill's comments about your accessibility and your warmth. So thank you for that. I also want to just say that working with your department has always been very collaborative and productive. So that always doesn't happen. We have access to other Medicaid departments in other states, and it's not as open and transparent. So thank you. With all of what's happening in the federal government, and there's a lot of uncertainty, there's a lot of talk about optional programs and the services that many of the individuals receive in North Carolina are categorized as optional. But if you ask any family member, they're not optional, they're necessary. These are things like personal care services, many of the waivers. What is your thought on how to ensure that access to care for those types of services that are categorized as optional continue with any direction from the federal government to cut North Carolina's Medicaid budget? Should that happen? Just want to be clear, nothing has been given right now. No instructions have been given.
Yeah, thank you, Lee, for that question. And I should have mentioned in the opening remarks, for 2 years, I ran the home care business at Duke. I'm familiar with Beata and the good work that they do, and also I'm really fond of the home care process, particularly when you think about how you take family caregivers and others and make them part of that process. So thank you for doing that work. As it's related to Medicaid, we are entirely focused on this idea that even a small change can have profound impact. And as we think about things that we are allowed to cover in Medicaid versus not allowed to cover, you're exactly right. We've been given quite a bit of, not quite a bit, we've been given some well-established license and liberty that allows us to do things in the Medicaid space. The federal government allows us to do. That's been incredibly important as it relates to social drivers of health and so forth. So we're going to continue to push for that as much as we can. And the best way we think we can do that is to convince federal lawmakers that the Medicaid program as it currently stands is a good program. It is actually designed in North Carolina in particular to bend that cost curve, to improve outcomes. If you think about everything we do, it's just not the bricks and mortars delivery of care. We have a robust virtual program, an incredibly strong behavioral health program, and we have these optional programs and PCS things, as well as waivers. So we haven't heard anything about some of those outside of the traditional Medicare program things going away. We are admittedly a little bit concerned because, they may not be front and center and top of mind. But we hope that we can convince federal to touch Medicaid and any of the other things that are currently affiliated or associated with it, because it is so critical to what we're doing in North Carolina. It's rare that you argue to keep the status quo, but if you look at the status quo for Medicaid in North Carolina, it's really about changing outcomes, and that's one of the other things that we're trying to communicate. It is an area that we've got fairly universal consensus among all stakeholders as well, and we're seeing all 50 states essentially having the same dialogue with their federal lawmakers. So I'm going to keep my fingers crossed that despite the fact that they want to find $880 billion over the next 10 years, the pathway there isn't to make any kind of broad sweeping cuts to Medicaid.
It's interesting. Thank you, Lee and Secretary. It's interesting. We had a big discussion this week about in our advocacy work, should we even use the word optional in communicating with members of Congress? Because, optional kind of leaves that impression, if you don't know better, that it's discretionary or not is something that you can do if you want to do.
Yeah, that's a
And
good point.
I think we've kind of settled on, we're talking about the value of services and things of that nature. But that's a question I think everybody's grappling with. Let's see. I think I saw Dick Shady's hand up next. So Dick, go ahead.
I think I will, but Gina has been up here for a while too, so I will.
I'll follow you.
Oh, okay. Well, thank you. We're still being very polite.
Oh,
Anyway,
her
Mr.
hand is so light. For some reason, hers shows up as a pale.
Oh, yeah. Well,
Go ahead.
anyway, Mr. Secretary, thank you very much for being here this morning, and I appreciate your willingness to step into a very challenging role at this point in time. I live in Carroll Woods, and I represent the Association of Continuing Care Retirement Communities, and I also have my own advocacy sites. But I wondered about Social Security in particular. You know, from various news stories, the agency itself is just in chaos between these various cutbacks and people fooling around with programs. And I wondered what the North Carolina congressional delegation is very important here. Both senators are very important. Virginia Fox has a very important job in the House. And so I wondered what either you or I assume there's a National Association of State Health Directors, and they all have the same exact issue, that these monthly checks are just a lifeline to so many older people, disabled people, and even kids. So I wondered, what are either you or the National Association communicating to Congress about the status of Social Security?
Yeah, that's a great question. Thank you for that. We haven't specifically communicated about Social Security as it relates to the impact on the agency. You know, as you know, it's only in the last week or so that we're starting to hear these stories about checks and that kind of stuff. Up until now, everything we have heard was that Social Security won't be touched. But I think, you know, what we're hearing now is a little bit of a different story. As it comes up, we will certainly advocate to make sure that that program maintains its status. You're exactly right. The checks are important. It's important for members of our IDD community and other communities as well. So what we have, actually, you may not know this, but the governor's office actually has a office in in Washington, D.C. So Governor Stein has an office in Washington, D.C., several very capable individuals who really understand the federal landscape, who help us connect. I will actually be heading up to meet with our federal teams, our congressional delegation, and hopefully have time to meet with the senators as well, and maybe even members of federal HHS to communicate those priorities. But if we start seeing serious signals about the vulnerability of the Social Security program, it'll be hard to argue for the HHS programs without also simultaneously arguing for retaining the Social Security program. I mean, that's pulling the rug out of, and it's fragile to begin with, but it would be pulling out a fragile rug. So we will definitely advocate for that if we find that that's also at risk.
Okay, thank you. So I see several hands. Just to give you a little bit of order, let's go with Gina and then Tina Miller, Lee Little, and then Lindsay Gordon. So go ahead, Gina.
Great. First of all, thank you, and it's good to see you. Gina Upchurch was senior pharmacist in Durham. I don't know if you know, I'm also on the MedPAC now, so I have an opportunity to take some of what we're learning in Durham and the state but I don't represent MedPAC here, just me. And thank you.
Hope it's still around, Gina.
We are still around, thank goodness. So far, so good. Where's the wood? I'm knocking on wood. Okay. So I also just want to reiterate Mary's, you know, you stepped in at a really challenging time. So thank you for your leadership. You know, I heard this morning or yesterday the announcement about ACL, which Administration of Community Living, being disbanded by Kennedy and put into different places. So we are one of the SHIP coordinating sites for North Carolina. So we receive some SHIP dollars. The state of North Carolina, I think, gives about 40% of SHIP money. Feds give about 60. I have this strong feeling that the federal government's going to say, we're not cutting anything. We're just going to tell the states to cut things, right? So a lot of pressure is going to be put on you all. And I mean, I just want to stress how important that program is to people and making sure they have coverage and stuff. But I have two questions for you, not really related to that, but I just want to make sure people knew about that. The first one is, you know, different people have Medicaid, right? So you have this expanded group, and then you have for many of us, you have the straight up Medicaid folks and then the dual eligibles. People have Medicare and Medicaid. And we know they're the more expensive people, but they're also the more vulnerable people. So I didn't know if there had been any conversation. I mean, they're all vulnerable. We're not going to fight over who's more vulnerable. I mean, honestly, that would be silly. But it's just, you know, if there's any thinking you have around if there have to be reductions, how that might look in the state. And then a second question, somewhat related, is especially in aging services and disability services, so much happens at the local level, right? With community-based organizations, many of them getting federal funding, state funding, many of them raising money to get it done or using private pay to get it done. So, and you've come from academia, right? And the health system. Can you think of any ways that we can continue to build on this idea of states and hospitals working closely with community-based agencies to improve care? I know we had these healthy opportunity grants. Where does that sit? Maybe an answer to that, but lots of questions. Thanks.
Yeah, no, thank you, Gina. It's great to see you, and thank you for all the great work that Senior Pharmacist does. As far as reductions go, you're exactly right. It's so hard to figure out how would you prioritize any kind of reductions or cuts in Medicaid. So what we have largely been contemplating around is any sort of federal action that it might relate to things like work requirements or other things that would that are conceivable, just given the reality if there's a pressure to do something. But you're exactly right. My take on it is that the more we invest now in the duals population and in the IDD population, the more money we'll save later on. It's absolutely clear when you get them the meds that they need in a timely fashion, when you get them to primary care on a routine basis, it actually decreases hospitalization. So those are the things that we want to focus on. And I want to bring that experience because that's exactly what I learned at Duke is when you invest, you actually save more money or you spend less and you actually get better clinical outcomes. Who figured, right? You actually can improve care at the same time. So I think that that's an important thing. Your second question related to aging and the IDD community health systems working together, I think we absolutely need to do that. You know, one of the important things I've said as a job of the secretary is to make it easier for local entities to do their work, whether it's county DSS, whether it's local health departments. I think things like Healthy Opportunities demonstrates how it works. So I was excited to see that the governor wants to continue and expand Healthy Opportunities in his budget. But I think that's the vehicle that we're going to have to use to demonstrate that we can get change. And we don't have to wait a decade to show the change. We can get better clinical outcomes and save $1,000 a year per member by investing in things that I know Senior Pharmacist has been talking about forever, like food, transportation, easy access to medications. So we think Healthy Opportunities is actually the vehicle to bend that cost curve.
Thank you. And Gina, you are true to form. You always have a way of getting multiple questions. So I'm glad you held up to your tradition there. So, Secretary, I think I read someplace that HHS is not going to approve any more things like Healthy Opportunities for other states. Am I right on that? I know that they're approved North Carolina going forward, but I think I read something this week that might be something that they aren't going to fully support anymore with other states.
Yeah, you know, I don't know. You can imagine that some of these things are just going to be on the chopping block that others are. If you look at our Healthy Opportunities that we have in North Carolina, it actually spans 2 administrations. It spans the most recent presidential administration and the one prior to that when it first got started. So, you know, we're going to keep our fingers crossed that that waiver will still apply to us. We have heard from many other states. How are you guys doing it? So that interest in other states hopefully will allow for some longevity to the program and sustainability.
Okay, thank you. Tina Miller, call on you.
Good morning. I'm Tina Miller with the Western Piedmont Council of Governments. I'm the Area Agency on Aging Director. Kind of wanted to speak up and talk on behalf of our other Area Agency on Aging Directors. We have several on the call with us today. We administer the home and community care based grant with under the Division of Aging, and we do important services for seniors, older adults, and caregivers to help them stay at home, administer the grant that provides home delivered meals, housing, home improvement services, in-home aid, a lot of services, again, based in the community. Our senior centers receive funding from us. We have been plagued for years and years with flat funding, which for a lot of regions like mine is a decrease in funding. I'm based in Hickory. We serve Alexander, Caldwell, Catawba, and Burke counties. And it's been really challenging. We have huge waiting lists for our services. In just one county, in Burke County, for example, I have almost 500 people waiting for home delivered meals on a waiting list. And, huge amounts. I have over 500 in my region waiting for housing and home improvement services. Our waiting list just continue to increase as our number of seniors that are needing supportive services continues to grow and increase. And it's just really challenging with flat funding or decreased funding like I continue to get every year without an increase to how to meet the community needs. We get calls daily, just tons and tons of calls for the need for support. And it's just really discouraging. I'm just going to be really honest. I've been doing this for 27 years, and my counterparts, with the news that keeps coming out, we're really discouraged. And I just wondered, what kind of encouragement you can give us to keep doing the work that we're doing.
Yeah, thank you for that question, Tina. I wish I had an easy answer around some of what you're talking about. And I think what you outlined, we hear almost identical from the IDD community and the availability of resources there, similar to what we hear from other communities with our Office of Rural Health. I'm optimistic that the pause that the governor wants to have in at least some of the tax breaks, because ultimately this is going to be about having more resources and having more money. And the governor's budget contemplates how you manage some of the tax cuts, which will then allow more money to flow into the system. And so I think, what we've got to figure out is how we can get more money into the system. And then are there things we can do to allow us to be more efficient with the delivery of some of these services? But I appreciate, and I'm hearing some of your concern, Tina. I wish I had a better answer for you because, as far as encouragement goes, I am, if I had to say one thing about what I've learned in 12 weeks, it's the remarkable level of commitment that I see from individuals who provide these types of services. And when you can, if you're a social worker, for example, and you can go across the street and work for a hospital and make more money and have more predictability with the complexity of your life, but yet you choose to go to the other side of the street, which is usually an estate agency or a DSS office. Those are the individuals who inspire me to say, hey, do the best that you can, because these are individuals who are incredibly committed to the clients that they serve. So other than hopefully thinking we find more money in the state budget, then that trickles down either through reallocation of funding, which is certainly challenging right now, or implementing some of the tax models that the governor has proposed. I think we're all facing some of those same exact challenges. Need beyond resources, and how do you manage around that?
Thank you. Tina, I know that your region had some impact from Hurricane Helene, but I know also the whole Area Agency on Aging Network has been working very strongly, as has local aging programs, to address the impact of Helene in Western North Carolina. Is there anything you want to share relative to that and challenges that some of your colleagues and you might be facing when it comes to Helene recovery?
Thank you for that question, Mary. And, and thank you to this group and several others who have donated and supported the work that we've been doing in Western North Carolina to support older adults and caregivers. We were very lucky in our region to receive some, donations and things, and have been helping a lot of people with just a lot of different needs related to trying to get back on their feet and get their housing reestablished and things in the wake of the hurricane. But, and now we're facing devastating wildfires, and it's just, it's just one thing after another, which again, it's I'm trying to focus on the positive and helping folks instead of being so discouraged and everything. But again, the disaster recovery, especially, you know, a little bit further west than me, is going to take a really long time. We do, you know, really appreciate the support of North Carolina to continue to, you know, help build those folks up. But yeah, the needs are still there. It's just devastating to continue to see, you know, the devastation, and then again be hit by another, you know, natural disaster or something that just continues to wash out a bridge that was just rebuilt to try to gain access to someone's home. We still have folks, you know, in the West living in, you know, campers and things that don't have access to water and power and you know, sewer hookups and things. So it's just been really devastating. We're just continue to support those folks. The calls again just continue to pour in for the need for assistance. So you know, it's really just not forgetting us. You know, this wasn't. You know, we've been doing some Band-Aid fixes, but it's going to take a lot of support for Western North Carolina to rebuild their infrastructure and their roads and their systems. And housing just continues to be just the greatest need for older adults and things. Just having affordable and accessible housing options continues to build. And then again, just the need for funding to improve those houses and fix them up. You know, our tiny little budgets we have for housing and home improvement is just not enough to be able to, you know, fix some of these folks and their issues.
Very good. Thank you. Let's see. I think we will go. Who did I say next? Was it Lee Little, I believe? Yes.
Hey, this is Jill. I actually think I know that the secretary has to run to another meeting. So I'm so sorry about that, but I'm happy to answer any questions on behalf of the Division of Aging that I can. But did want to thank the secretary for his time here today and turn it over to you, Mary.
Actually, you know, let me just, I didn't realize I was supposed to end at 10:30, but I've been enjoying the conversation so much. And that kind of really just validates the fact that we need to do more things like this, where we have an opportunity for me to hear firsthand, for our divisions to hear firsthand what's top of mind for you. And certainly you're welcome to route any questions you have through Jill. Jill, let's make sure that you and I have an opportunity to connect to make sure that we can circle back and give individuals the answers that they're looking for. But I think that this, in my mind, has been a really successful opportunity to connect with the community. I want to make sure that the agency is of service to you. So if you're feeling that that level of connectivity isn't there, please let me know. Please let our teams know. I think that it's really important for us to hear from individuals who are doing the work day in and day out. One of the things that I've committed to is to not make any major changes without actually walking in the shoes of the individuals who are going to be impacted the most. And I think that applies particularly to members of the coalition and the important work you do. So I apologize for having to drop off, and they're texting me again to say, where are you? So I'm going to sign off here and say thank you so much for this wonderful opportunity. I hope you have a great rest of your meeting and a great weekend, and I look forward to the next opportunity to connect with you.
Thank you so much. We appreciate it.
Right.
Thanks.
Thank
and we
you.
do hope to follow up with other opportunities.
Absolutely.
Thank you.
We will.
All righty.
Most definitely.
Take
Great.
care.
Thank you.
Bye-bye.
Bye-bye.
Okay, so Jill, you're willing to stay on and maybe take some things back to the secretary then?
Absolutely. I've been taking notes the whole time, and I'm happy to continue taking notes. If someone,
I didn't realize that he had to step off.
I actually don't think he did either. I saw him get a text message at one point, and I checked in with his executive assistant, and he was like, gotta go. And I was like,
yeah, it must have something come up because they didn't tell me that yesterday when we chatted. So
yeah,
and as things do,
things are very much coming up right now. I will say that the department is really working very hard to be nimble and responsive. And so he does want to apologize that he had to jump so quickly. But I have a feeling that it was a federal emergency, as they often are.
Well, we're certainly glad he was here, and please, we'll send him a formal note, but thank him again when you see him too. So Lee, go ahead. Just ask a question or comment.
Okay, well, good morning, everyone. My name is Lee Little. I'm actually wear two hats. I'm a current board member for the coalition and also a assistant director for economic and adult services in Wake County. The two questions I had was to see if he could speak about some of the federal mandates moving forward for adult protective services and where North Carolina stands in that. Oftentimes, from state to state, how we conduct our business and the policies are a little bit different in terms of processes, and wanted to see where we are with that. My second question was, I've been reading about some momentum on some different funding streams that could impact adult protective services moving forward and providing the local governments with some additional funding. Just wanted to see, is there any bills introduced this current time that could help and assist with that? Thank you.
Okay. Well, certainly APS funding is a huge issue. Thank you, Lee, for that. I would say, Jill, I think something that for the record, I think the coalition would very much want to go on record about with the secretary is we know that adult services is now has been removed from the Division of Aging, is now in social services. And I know there were reasons why that was done. I hope I think our message is we certainly hope there's a great deal of collaboration continuing between social services, Division of Aging, and that you know it just that whole issue of kind of the switch that was made is evaluated to ensure that it was a good move. So just I'll leave it at that. So let's see. I think Lindsay, you were next.
Good morning. I'm Lindsay Golden, Director of State Affairs with the Alzheimer's Association. Please pass our thanks for the Secretary for being here. I think it really shows a great commitment to this population that's so early in his tenure. He was committed to be this accessible. So I think it's really, really exciting to see that. So North Carolina has a dementia population of more than 210,000 people 65 and older. That does not encapsulate anyone diagnosed with early onset Alzheimer's, which is quite a lot of people in our state. So anywhere between 40s up to 65. So right now, that 65 and older population is about 12% of our aging folks in North Carolina. Dementia is the most expensive disease to care for in the entire country. So we're facing a big crisis, and we have almost 400,000 dementia-specific caregivers. Unfortunately, North Carolina has fallen behind many other states, including all of those surrounding us, in terms of our dementia policy, both at the state agency level and with policies that our legislature is passing. Would love to know the Secretary's perspective of as we are seeing prevalence continue to rapidly increase, and this is a huge issue. If I know a lot of people on this call as well have had someone go through a dementia diagnosis in their family, how we can support this population and make sure we can manage costs for North Carolina that are rapidly growing, especially with North Carolina Medicaid, and making sure we're supporting these folks.
Lindsay, do you have a specific example you want to give Jill to relate to the Secretary about how North Carolina is falling behind? Maybe like the bowl grant that wasn't continued or something like that.
Yeah, we have lots of information around, like, we have not had a single dementia law passed since 2016 in our state. Most other states have had many, many examples, so we can break down, Jill, kind of what that looks like. But I think a great example, like Mary said, is North Carolina was one of the first recipients of a BOLD grant. So it was free funding from the CDC that brought dementia public health information to our state. So we got a couple $100,000, and we had a BOLD coordinator in our state. So really aimed at targeting rural populations and diverse populations that don't always get great access to medical information in our communities. It was a great program, and unfortunately, we did not re-seek funding where we could have had over $1 million come back to North Carolina. And now North Carolina is one of the only states in the entire country that does not receive this BOLD dementia funding. So I think that's one example of how we have kind of fallen behind.
Okay, thank you. Let's see. I believe I saw Bill Lamb's hand next. Thank you, Lindsay.
Thank you. I've got my Friends of Residence hat on now. Just as the administration was changing, there was the state auditor issued a report that really had some serious citations about the regulatory oversight of nursing homes and not meeting federal standards. We're continuing to hear regularly from families who are saying that the response time in terms of filing complaints is lacking, is slow, or non-existent at all. And my concerns. I just read a recent report looking at 2024 data showing the increase in double G citations is significant across the United States. I looked at North Carolina data, and we are leading. We are one of the states leading that increase. Now, double G penalties are penalties where residents have been caused harm or that they're placed in immediate jeopardy. So, we've had a problem, during the pandemic related to staffing. We continue to have a staffing problem in facilities, but we also have, we don't want to exacerbate this with inadequate enforcement of minimum safety standards. And the department's response was basically that they have a staffing problem related to their regulators. And this is a concern for us. In order to be able to protect the most vulnerable people we have in our system, we've got to have strong enforcement of quality standards. So I kind of want to know what the department's doing about this. I know they're asking for additional positions and upgrading the pay standards for those folks who are doing this stuff. But there's a community relations problem here if we're not getting back to those families who are caught in the crosshairs of this thing, and that's breaking down.
And Bill, I believe that Governor Stein did have money proposed in his budget that he presented to the General Assembly for increasing the regulatory staff. So, but
I understand that.
Yep, exactly. All righty, well, thank you. Go ahead, Jill.
That request for additional staffing has been for the Division of Health Services regulation. And I do know this is top of mind, Bill, and I'm sure we'll have a full response for you all on that.
Okay, Richard.
Hi, thank you very much. I'm work with a company called SemberCare. We have several hundred personal care, CAPDA, adult care home companies that we bill for and assist with regulatory matters. I know money's a concern, so I'll try to address items that I think are non-monetary or effectively non-monetary. One is that the absolute need to do something to get healthcare coverage for direct care workers. The best healthcare coverage in the world being Medicaid. I think that you would find, this is my personal opinion, I don't know how well supported it is by the data, I guess we'll find out, but if a person making $15 an hour is serving someone with Medicaid and they can't pay their own Medicaid bills, they can't pay their own medical bills, that's a little bit ironic. On the other hand, if working in direct care work in a assisted living facility or in a nursing home or in a home care agency came with Medicaid, even at a buy-in amount, I think you would rapidly find an increase in people who are interested in doing that. Second point would be that there are a lot of non-monetary barriers to improving the number of people who can work in this, among which are unnecessarily burdensome and inconsistent rules of who can serve with what criminal background. For example, in the personal care situation, this disability for people to serve is forever if they have a drug felony. That's not the case in the CAP-C or CAP-DA or PDN or other areas. It's just inconsistent and it's keeping people out of work. You can run a home care agency with lots of drug felonies. You just can't actually do activities of daily living. That makes no sense. Third, I mean, what about the second chance? What about letting them after 7 or 10 years, provide service? The third thing is, these positions are mostly unskilled, yet they are subject to regulation as though they were serving in a nursing home. There is no reason why an aide who can do any one of the several activities of daily living, as long as certified by their nurse, they can do 2 of them, they can do 3 of them. The question is, competent to do it, why don't we let them do that? That would help resolve some of the shortages of nurse assistant ones that we face. And finally, our friends at licensure and our friends at Medicaid do not often enough sit down with one another and look for ways to reduce administrative burden. Medicaid has helped us through managed care. We used to have 1 payer, we now have 10, soon to go up to 14 or 16 or maybe 17 payers. That does not reduce administrative burden. The Division of Health Service Regulation, unfortunately, is charged to renew everybody's license at the end of the year. Why not spread that out over several months? And why not sit down together and reduce duplicative activities, such as 15 assessments of the same person? We're all paying for it one way or another, through taxes or through the agencies having to do it. So finding ways to reduce administrative burden, that doesn't cost money. And it would make providers more willing to have more room in their budgets to take care of people. Thank you.
Thank you, Richard, and thank you to SymbiCare. I don't know if many of you know, but SymbiCare provides the coalition with free office space, so we are very appreciative of that, and certainly for all the issues that you brought up. Let's see,
Carrie, is that
Catherine.
December care, like the month?
SEMBRACARE, SymbiCare. Richard, you want to explain what you guys do? You have a lot of hats and different things. Looks like you're on mute.
Yeah, we do billing. We do advise. We help people with audits. We maintain records, and we argify with our friends at licensure and at DMA and everywhere else to try to help providers function and be able to send people out there. We help with recruiting. We help with EVV. About the only thing we don't do is lend money. Other than that, thank you.
And you also do direct training of direct care workers too.
Yeah, we have a CNA school. A nurse assistant 1 school. We have a med tech school, and we have a nursing pool which goes out all over the state to provide nursing services and electronic tablets to get the assessments in electronically. So we've tried to do what we can to make the lives of community long-term services and supports providers easier, all the while facing the complexities of managed care. And every 3 or 4 months, Medicaid changes its mind about how it wants to do things. And so it's very interesting.
Very diverse, very diverse.
Yes, it is. Thank you so much.
Okay. Catherine, you're next.
Hey, thank you so much. I'm Catherine Long. I'm a frontline social worker my whole career, so I don't have the big picture. I do hospice home care in Western North Carolina, cover mostly rural counties like Avery, Mitchell, Yancey. I do dip into Buncombe, Henderson County, so got a pretty big area. And one of the things that I'm finding is that because these are folks at end of life, right? They're hospice patients. And even with the systems that we have now, I'm having some patients that actually pass away before we can get the help that they need. And so anytime I'm in any kind of meeting like this, every population is important. I'm not trying to minimize anybody else's need, but when you've got a group where their life expectancy is limited, if there's a way to prioritize services so that the ones that are near the end of their life can get the help that they need a little quicker, that would be great. It's hard I push anyway. I don't, even with the limited life expectancy and knowing how convoluted our systems can be, I push anyway because nobody has a crystal ball, but it is really hard to watch somebody pass away when they could have had more support in the home with better quality of life. So thank you guys.
Catherine, are you with a hospice agency?
Ma'am?
Are you with a hospice agency or?
I am. It's
Uh-huh.
MediHome Hospice. I'm a home care social worker for them.
Thank you for sharing that.
Thanks,
Appreciate that. Other hands, I don't see any right now, but that could be me not seeing you. Like I say, some of these hands are showing up really, really pale, and I didn't see Gina's. Okay. Anything that anybody wants Jill to take back to the secretary that has not been covered so far?
If I could ask a question, and it's not, I don't know the answer, but AAA directors would know that are here. I mean, there's so much federal funding that comes to the local area agencies on aging. Are there, I don't know how North Carolina stands with other states in terms of like relying on that versus having private, charitable dollars. Is North Carolina more reliant on the government or less reliant for those services? Does anybody know? Because, not having diverse and it's hard. I mean, it's hard it's not necessarily sexy to run a senior center, even though I think it's really sexy, but so, I mean, it's just hard. And, yeah, I'm just curious how North Carolina stands related to other states in terms of reliance on federal funds for our AAAs.
Jill, do you want to answer that?
I don't know the answer. I don't know the answer about how we compare to other states. I can say that the Home and Community Care Block Grant matches federal dollars with state dollars and local dollars. And that funding is passed to our counties and our AAAs through the intrastate funding formula. And the amount that we get from the federal government is also driven through a funding formula that's based on our population. And right now, North Carolina is the 9th in number of older adults 65 and older, and the 9th in terms of total population. But Tina, do you or Holly, I've seen on the call, I've seen several of our team members on the call have any comments about how we compare to charitable funding? I'm not sure what the AAAs and our other services receive in terms of charitable giving.
I would just say that we are very fortunate in North Carolina to get the state level of funding that we get that adds on to our Home and Community Care Block Grant compared to some of our other states and things. And then, local support. We do all of our service providers who provide home and community care based services have to put in a 10% local match. Which is a lot. This is for a lot of our providers is a money loser, not a money gainer. And so to have our service providers continue to provide these services is a real commitment to, their service to the community. And we're all over the place. We have, county providers, for-profit providers, nonprofit providers, that are providing these services. In my region, we've been very lucky to have very consistent providers that have been doing this for many, many years and see this as a true commitment of service to the community. I will say that North Carolina, with the AAAs and the Council of Governments who we are all housed under, have recently formed a North Carolina Community Care Hub. And with that Community Care Hub, we are actively pursuing grants and other funding streams through affordable care organizations, healthcare organizations, insurance companies, those kinds of things to try to get funding to continue to do the work we do and expand the services that we're able to provide. It's very hard on a local level to go after those funds. But this is a community care hub that has statewide coverage for North Carolina, and a lot of different groups are really interested in being able to have us provide services and pay us to be able to do that, which again, we will turn around and put that money into expanding services.
Tina, I don't know if you're interested or not, but our newsletter gets pretty good distribution. If y'all want to send us a write-up on that, we will put about the Community Care Hub. We will put that in there, and maybe you might reach a few more people that haven't heard about it.
That'd be great. We are just forming and getting started, and our website's not even active yet, but we are a 501c3, and we have a name and our membership agreement. So we're really, just getting started, but we're very excited about it and think it's definitely going to be a future way for us to, again, expand services. But I'll make sure Mary Marlin probably can send you something on that. She's the head of our NC4A association right now and heavily involved with the Community Care Hub.
Right, that sounds super. Back to the question, just about.
Sorry, Mary. This is Holly.
Oh, go ahead, Holly.
Sorry.
Yes.
So all of our AAAs run a little bit differently. We allocate all of our funds mostly out for direct services within our counties. So we're not the direct service providers for many of the programs. I just like to clarify that all the AAAs do it just a little bit different. But in our counties, our programs are overmatched by hundreds of thousands of dollars. So your county's tax dollars are going into Older American Act fund programming. We have 2 non-for-profits in 2 of our counties, and they fundraise like crazy. They have resale shops. They have storage units. The county gives them their senior center buildings for $1 a year. So there are lots of aging funds that are donated or fundraised for within our area, because we have Brunswick County and it's a retirement mecca there. And your Older Americans Act funds, based on that interstate funding formula, are rural minority poor. So my counties are getting cut, even though they're growing extremely in population, because the people retiring here are not usually rural minority poor, but they're using the services. And so once again, the consumer contributions help a lot if we could educate people on how they can contribute to the cost of the programs that they are benefiting from. So I just wanted to add that little piece. Thank you so much, Mary.
Yeah, well, thank you for adding that. It's very, very pertinent for sure. I just wanted to mention about the role of nonprofits. Now, this is just not nonprofits that work with aging, but the North Carolina Center for Nonprofits, I believe it was, just put out information about nonprofits in North Carolina. And there were like 9,800 that actually fill out a 990 every year and file it with the state. And I know that many of those nonprofits are small organizations that, they don't have a lot of reserve that they can draw on, but they certainly do. They punch above their weight in many cases. And I think that many of them are very anxious about what's going to happen with the federal funding that's going on. And we know that whatever happens with federal funding is going to impact state funding. So it's just not governmental agencies that are going to feel the impact of the environment we find ourselves in. It's also going to be those nonprofits that serve, very important roles at all levels of our state in North Carolina. Toby, I think I saw your hand again.
Yeah, I want to bring attention back to the issue of people who are older and deaf and hard of hearing and also blind and have mobility impairments, because I have concerns about what's going to happen with the division of services for the deaf and hard of hearing, division of services for the blind, and so on, in terms of accessibility, communication access, and just accessibility and accommodation in general. Because I think what's going to happen is a lot of people, agency businesses, are going to start cutting short on that, especially when they're cut in other areas. And as you all know, more than half of the people over 65 have significant hearing impairments, and hearing impairments are correlated significantly with dementia, fall, diabetes, and a host of other medical issues. So I'm very concerned about how DHA is actually going to handle those agencies when the federal changes come down to our state levels.
Well, certainly we're all waiting to see what's going to happen, I think, and it's certainly going to be flexible, adaptable, and hope for the best. That's for sure. I don't see any more hands up right now. So Jill, certainly give you the opportunity if you want to do anything on behalf of the division, or any report or anything else, or any closing comments on things.
I just want to say, I really appreciate each of you for being here, for hearing from the secretary and to also raising your concerns. It's really important that we raise up these issues and make sure that we see each other and see ourselves in the policies that are being promoted and in the issues that we're working on. I know that when he says we want to make sure we have a strong Medicaid program, that is really going to influence many of our populations. And I wonder how our aging services and our network is able to stand with the department and with the state as we promote those types of policies. So that's just something that I'll say. I hope that you all see yourselves, see our communities and the priorities. I certainly do, of the administration. And I think, as he said, he's very open to listening and he's very open to being a part of this solution, and just really appreciate each of you for walking with us. I am going to, if you all watched me type, which I don't put it on the screen that often, I'm a typing nightmare and my E key is sticking. And so every other word does or doesn't have an E that should or shouldn't be there. Questions to clean up before I send those up to the secretary's office. But I think that this was a really beautiful opportunity to share. And I look forward to moving forward with you all. I think, Mary, will you be giving an update on kind of where the legislative agenda is?
Yes, we will.
Okay, great. Well, then I won't do that because I would be, Mary will do a better job than I will, I know. But I just want to say thanks everybody for your time today and for walking together in this uncertain time.
So Jill, one more thing to add to your list.
Yes.
Certainly the elevation of the all ages, all stages plan. We know that the plan was unrolled the day that Hurricane Helene came through North Carolina. We also know that there's been a lot of water over the dam the last 6 months with things that have just thrown everybody off kilter, and everybody's adapting and trying to figure out what's next. I told somebody the other day, I've been in this business 50 years and I've never seen agencies and individuals that work in health and human services as anxious and stressed as they are now. So I think with all that said, I think we certainly want to continue to use that plan as a blueprint for moving it forward. And that I know the department's been very supportive. We certainly appreciate that continuing support, but know that, we don't want it to lose momentum in the process of everything that's going on right now.
I totally agree. And the secretary certainly touched on that a little bit today. And I think that as you and I have spoken, Mary, about this kind of extensively, there are so many parts of all ages, all stages, this first part of the plan that align to where we are going and what we are doing. There are also things like fighting for Medicaid that we didn't expect to be doing in this time and space. And so I think that the plan will adapt some to make sure that key items like supporting a successful Medicaid program that we didn't think we would be doing will kind of be added to the plan, whereas other things like supporting family caregivers, which we have as a priority in the plan, will continue to move forward with the department's support. So I think we'll continue to talk about the successes that we're seeing and making sure that we're not losing momentum and telling people the momentum that we're seeing. I think part of being a winning team is putting those wins on the board, showing the scoreboard, showing the points that we're scoring. And so I look forward to lifting up the great work that we're doing and the many successes that we're going to have together through the plan.
Very good. Thank you much. All righty. So let's go back to the top of our agenda now. So we had information from the last meeting has been posted on our website. So check that out. But Lee Dobson, do you have anything financial report to share with folks? I know information was sent out, I believe.
Thank you, Mary. Yes, as Secretary Treasurer, I'd like to report that our financial situation is as planned. So we're we're on target. Our expenses are consistent with what we are expecting. Renewals are a little bit slow coming in, so if you haven't renewed your membership, please do so. If you're looking for an invoice, let us know. We're happy to send one. There are no unusual expenses, and Sandra is doing a great job kind of managing the books and learning all of the back end systems that keep this organization going. At this point, I'd like to open it up for questions if there are any.
Okay.
Hearing
I don't see
none,
any
we'll
hands or
move on.
anything. Yeah. Always good to know that our books are in order. Financial books are in order. Okay, let's go to updates from the Coalition on Aging. You know, and Sandra has been on board almost 2 full months now. It's hard to believe, and I would say she is like a sponge, just soaking up stuff. And hard to believe it's just been 2 months, Sandra. So take it away with updates that you might have.
It is definitely hard to believe it's been 2 months. 2 newsletters under my belt now. Since if you haven't seen it yet, the second newsletter went out this morning, maybe a little bit better modeled than the first one when I was learning how to do the system. And Tina Miller, I have something for all of us to think about. I grew up in the disco era, so there was a song called "I Will Survive." I play that over and over in my head as we're going through these times right now because I always, in my past life working with United Way, I always tried to keep the people who were receiving the services in front of whatever decision was being made. And I know that that's what everybody on here does as well. And it's very good to come into an organization that has such camaraderie and working together. And it's been a great 2 months, and I'm looking forward to learning all I can from Mary, because every one of you know that Mary has that knowledge that we all wish we could keep and have. So, and I'm also gaining knowledge from all of you as I come across you in different areas and arenas. So it's been good. We've got some good things as far as the coalition that we're looking at. Different eyes kind of looking at our operations and how we are presenting information on your behalf as far as advocacy efforts and making sure that we are working with our members in order to do that and carry that torch forward as far as aging issues are concerned in the great state of North Carolina. And as I am approaching 60 years old, yes, that aging issues are very important for all of us, because if we're all lucky enough, one day we're going to be there. So that's a positive thing. Mary will tell you I'm a positive person, so I don't take lightly what everybody has said of the concerns and everything, but I do think that we will survive through this. And I'm thankful it's spring. If you saw my newsletter, I'm a plant person, so spring helps me renew, rebirth. And I'm probably going to be in the plant store very soon. So, how's that, Mary?
That's good. Yeah, we used to run a plant store, my husband and I, and we love people like you. We used to say plant early and plant often.
Yeah,
because you put them out early and let that frost get them, then come back and see us.
I learned that lesson a long time ago, so I'm better at that now.
Yeah. So, anything specific?
Yeah, Trish had to drop off. She has another conflicting meeting this morning, but I do have a couple of updates on the essential jobs, essential care, and We Care information. There's information in the newsletter that just went out, particularly about the potential Medicaid cuts. And so that the Essential Jobs, Essential Care group has really been working along that. So if there's also a flyer in there, if you want to download that to share with your constituents or with your clients, I think that's a great work together that can help people, make it easier for them to advocate for themselves as well. They are also in the process working with the Serious Illness Coalition, the North Carolina Caregiving Collaborative, the National Domestic Workers Alliance, and the North Carolina Council on Developmental Disabilities, trying to have that unifying message as it relates to Medicaid. And also looking for storytellers, people that that may be willing to tell that story. And Trish's contact information regarding that is in the newsletter. They're also focusing on District 9, kind of that area, because Representative Richard Hudson actually sits on the committee that handles the decisions regarding Medicaid. And as Trish put in her notes, on a more positive note, the coalition also is continuing its partnership with the North Carolina Center for Workforce for Health, and it's hosting its 4th workshop next Friday, April the 4th, for the direct care workforce. This is a workshop on expanding and stabilizing the direct care workforce. That's been a very good relationship with that organization, and working through that. And if you're interested in that, again, the information is in the newsletter, but it's also the registration on that closes on April the 1st. Any questions on that part?
I'll just make a comment, Sandra. So the importance of telling stories. Everybody you talk to, from members of Congress to people that do advocacy for a living and paid consultants and all, say you've got to put a face on the issue. You've got to be able to tell the story about what difference does it make. So with Medicaid or home and community-based services, Older American Act funds, whatever it is, we've got to put a face on it, and we have to let people know what would happen if there's a reduction in funding, or heaven forbid, if funding goes away. What impact would it make on people's lives? And I will tell you, this whole time we've been doing trying to collect stories, there's no shortage of stories from people in the disability community, particularly intellectual and developmental disabilities. We are having a heck of a hard time getting people in the aging communities to tell their stories. And I think,
Mary, can I speak to that? Because I actually, after you asked me about that, I sent it to our staff, and I haven't heard back from them. And I was like walking up down the hall going, I think it's so overwhelming. Like, they're like, well, there's a bazillion stories. And it's also hard to disentangle Medicare from Medicaid. You know, if you have Medicare and then there's the wraparound, like exactly who's paying for what in some people's minds. So I think that's some of the complication. I just wanted to put that out there, because I was like, what is the problem here? And then I had to send them the list of optional things. And they're like, oh, I mean, yeah.
Right. I think it is. I think the big thing is to talk about if we don't have help, what's going to happen. You know, I know people personally that if they didn't have that home health aid, if they didn't have that transportation assistance, if they didn't have that ramp that had been built to allow them to get in their house, they could not stay in their home. Or they might not be able to stay in assisted living facilities if they didn't have state county special assistants. Or, you know, if Medicaid didn't help cover their nursing home care. But we've got to get some stories. And I mean, we've got a few, but we don't have what we need. So one of the things we've changed the wording from what would it mean if you lost Medicaid funding to say, what would it mean if you lost the help you received? And I think that's the important question we've got to get out there. I mean, quite frankly, you know, if Medicaid gets cut, then that's going to impact the funding available to everything else in North Carolina. It's going to impact whether or not there's money for the Home and Community Care Block Grant. It's going to impact if there's money for the Housing Finance Agency, if there's funding for transportation, schools, the whole bit. You know, if Congress goes through with what their blueprint for what they want to get in savings for Medicaid, as the Secretary said, is $880 billion over 10 years. And you break that down by year, that is a heck of a lot of money that states would have to make up from somewhere if we continue to level of services. So look at that information in the newsletter. Do see if you can help with your networks to get information out and to get stories that can be utilized, not only for the media, but in contacts with elected officials and just things that we can do in presentations and things. As far as the work of the coalition regarding advocacy, we're doing a lot of work right now with the General Assembly and things that are pinned in there. You will see in our newsletter when you open it up, it's in your inbox right now. We've kind of broken it down regarding a lot of the bills that are introduced in these priority areas that things are going on under. One of the biggest things that we are hoping is going to take place in the next couple of days is there's going to be a bill introduced to establish a study commission on aging. We had one until 2011, I believe it was. It had been in existence for basically 25 years and then was done away with. Since that time, we've really seen a decrease in the amount of aging-related legislation and appropriations that the General Assembly is doing. So we're able to help draft the language for that legislation and hope that will pass. It will be one of the primary issues that we'll be talking about at an Aging Advocacy Day. We are working with ARP, Friends of Residents in Long-Term Care, and some other groups to have an Aging Advocacy Day again this year, and it will focus on certain things. We are still kind of waiting for the final tentative approval about being able to use the auditorium in the State Library building next door to the legislative building, kind of as a convenient spot before we announce the formal day. But it looks like it's going to be May 7th so put that down as a tentative date. The backup day is May 6th, but we will have a lot of information coming out for folks about that. And I think the timing on that's going to be real critical because, by that time we ought to know a little bit more about what Congress is going to do relative to some federal dollars. And the state will begin to be thinking about what they're going to do with state budget and things of that nature. At least some preliminary decisions will be made on that. Just so you know, we're putting a lot of focus on, as Sandra said, about Medicaid advocacy right now. A lot of our effort is being devoted at the congressional level, but we're also talking with people in the General Assembly relative to that. Another top priority area that's getting a lot of legs this legislative session is property tax relief for folks. There have been about 13 bills filed in the General Assembly regarding property tax relief. 6 or 7 of those deal specifically to homestead exemption or the circuit breaker program that impacts older adults and persons with disabilities. So I've had the opportunity to go to some community forums lately, and it is such a hot issue, particularly in counties in which property values have gone up huge, and people that have been in their homes 30, 40 years cannot afford their property taxes anymore. But it's also an issue in some of the small counties in which property tax rates have gone up also. I think I saw a couple of folks from ARP on here, Chris Brandenburg, and I think DeMarcus was also on here. And I know Work and Save is one of their priority issues, so we're working on that too. All these issues are priorities in the state multi-sector plan on aging too. And basically what that would do is establish a state facilitated, privately run Work and Save program for North Carolina that people who do not have a retirement savings program like a 401k or something like that through their employer, it would allow people to have an option of basically signing up for a program where they can save money. And research has shown that if people are going to save money, the best place for them to save is through workplace options of saving. We also are looking at just, the whole issue about workforce and Medicaid rates and things of that nature are big on our list too. The governor's budget, as we've talked about, was released a couple of weeks ago. There was not specific things related to aging funding in there. We already talked about money to increase the number of staff at Division of Health Services Regulation that do inspections and regulations and things of that nature. There has been a bill introduced in the General Assembly to establish a North Carolina DAVE program, which I forget the exact wording that it is, but basically it's a North Carolina version of DOGE at the federal level to look at efficiency of government operations. And the leader of the Senate, Phil Berger, is one of the sponsors of that legislation. So, we could have a North Carolina DOGE in our state too. The continuing resolution was passed by Congress. We know kind of a last minute on March 14th. It does carry government operations at the federal level through till September 30th. So it gives them all this opportunity now to focus on budgets for the next fiscal year coming up. We've heard a lot of questions or comments been raised about Social Security. We know that there had been originally 4 offices for Social Security slated for closure in North Carolina. We've been told that it looks like maybe they might be off the chopping block, but we also know that a lot of longtime employees with Social Security have resigned their positions because of, basically getting the letter from DOGE, or they're at risk of being laid off. So there's already been a significant workforce reduction. I know Lisa Wallace, I saw her on here earlier. Lisa, has been a longtime employee for Social Security. And Lisa, I know that you took the option to retire based on, and I know in our meeting last time, Lisa had just gotten the notice from the DOGE team that morning about retiring. So Lisa, do you want to say anything relative to that if you're still on?
Yeah,
Brian,
can you guys hear me?
yeah, and I see Brian Simpson's also on. So
Okay, wonderful. Well, that's great, because I did want to say thank you to everybody within North Carolina Council on Aging. It's been great, and I plan to continue to be part of the North Carolina Council on Aging and work with people across the state, but it'll just be in a different avenue that I haven't figured out yet. But I do enjoy helping people and enjoy being around other people who enjoy helping people. Brian is going to do a great job here in North Carolina. So any speaking engagements that you need taken care of, I'm sure that he'll do everything he can to make sure he can handle those, even with everything that's going on with the agency. But I did want to say thank you to everybody in the organization. It has been my pleasure, and I do plan to continue to work with the aging community in North Carolina in some way, shape, or form. But everything that you guys are feeling, we're feeling it a little bit even more amped up within the
Lisa,
agency.
how many years did you have with Social Security?
27 years. 27 years.
And
Yeah.
if you actually, are you gone already?
My last day with access to the network will be April 18th. So I can still be reached at my work email, but as of April 18th, I'll be turning in my laptop. So that'll be the last.
Lisa, this is Sandra with the coalition. Please send either Mary or myself your email, that we can make sure that you're still on the newsletter list and keep in connection with you.
That sounds good. I sure will. Thank you.
Brian, I know you are still, you did not take the offer. You're still at Social Security. So anything you want to say?
I'm still here, and I put some links in the chat for everybody.
Okay, thank you. We appreciate that. There's a lot going on, and you guys may be like us. We rely on a lot of the national aging advocacy groups and all to keep us posted on the latest things going on. You probably saw, and it's been alluded to already, the announcement that came out yesterday about the changes in Health and Human Services, that 10,000 people have already retired or taken other options not to work anymore for Health and Human Services. And they're also laying off another 10,000 people. And we heard that the Administration for Community Living, that basically had agencies that are programs that dealt with older adults and persons with disabilities, is being disbanded, and their functions are going to be split out among other agencies within Health and Human Services. I think the fear that all of us have is that it's going to be diluted. Aging and disabilities is going to be lost in the process. Like one of the agencies that is going to be taking up some of the things they did is CMS. We know how big CMS is, and we know where their priorities are probably going to be. So I think it's incumbent upon us as advocates to use our voices to talk about the fact that we don't want aging and services and programs for persons with disabilities to get lost in the wash. So keep on the lookout and use your voices to be advocates in that instance. Two of the groups that I think are doing a great job of sending out information about what's going on is Justice in Aging and the Benjamin Rose Institute on Aging. So if you aren't signed up for their materials, I would encourage you to get on their mailing list, because they do a good job of recapping what is going on. And just to give a plug on, I think it's May 15th, or it may be April 15th. Anyway, coming up soon, the Benjamin Rose Institute is doing a 90-minute presentation about celebrating milestones in elder care. Bob Lancato is going to be a part of that. I think most of us had exposure to Bob. He's kind of like an old war horse that's been around for 50 years in aging, but does a great job of really staying on top of things. But he's going to talk about some of the evolutions of some of the programs and think milestones that really happened in aging in our country. So a lot going on for sure at this stage of the game. I do think our newsletter this month kind of gives a good overview of all these things we've talked about and some others too. So I encourage you to look at that. Anything else that anybody or has questions on anything related to that?
Just quick follow-up. Mary, you had mentioned some reorganization. I thought at the state level of departments or divisions. Is that, could you
Well,
go
what happened, and this has been several months ago, is the adult services section, which deals with, adult protective services, guardianship, those types of programs, it used to be under the State Division of Social Services. And about, well, I want to say 20 years ago, 18 years ago, it was moved to the Division of Aging. Recently, those were pulled back into division. So it now, and there are now regional offices for social services that deals with a lot of issues that counties need to deal with and on a regional level. And that's probably one of the reasons that was done. But I don't know, any of you on the phone who happen to be engaged with social services, if you have anything you want to add on that, certainly appreciate that. Okay. Well, I think you could make the argument whether or not it was more coordinated approach to things when you had all aging things under one roof, or whether or not now that they're in two separate divisions, that's going to make a difference or not. We'll see. Time will tell, that's for sure. Okay. No other questions on any of that? A lot going on. All right. Sandra, I think you want to do the Public Policy Committee update.
Yeah, and you kind of were alluding to it. We are waiting for that May 7th date for the coalition and the AARP and others that we're going to be working together to have our advocacy day. We will send that out to you, confirming that as soon as possible. The coalition is also working with the I guess it's the Division of Aging that hosts the Older Americans Month, which is May. And we're going to be working with them again for an afternoon event, hopefully on May the 7th, that will be at the farmers market. So as soon as we can get all that confirmed, we're 99% there. We'll send that out to you as well. So we're looking forward to working for both of those events.
And for a celebration in the afternoon.
Yes.
And in the newsletter also, there is information about the theme for Older Americans Month this year. And hopefully Administration for Community Living is still sending out information, or has information still posted on their website about ideas and other things that you can use to help promote that month. They always do a good job with their materials that people can utilize for that. Okay, I think the Health Equity Committee, I know that Daryl had to leave, but she was going to call in from the car and make her report. So.
And I'm available too, Mary, by the way.
Rosalie, yeah, Rosalie is the co-chair of that. So I don't know how you guys want to handle that. So
I can do the update so Daryl can focus on driving and is not
good idea,
putting herself at risk or others. So we just have a few highlights from the Health Equity Committee. The meeting that we had recently, our monthly meeting, discussion involved the Health Equity Committee's progress, strategies to improve the quality of life for older adults in North Carolina, the potential changes to public programs affecting older adults, and the future direction of the committee. The team also deliberated on adjusting their public stance on diversity, equity, and inclusion due to the current political climate and the need to maintain a strong public stance while avoiding unwanted attention. We discussed the impact of recent political changes on aging and disability services, the potential funding cuts, its impact, and the impact of certain terminology on grants, and Medicaid, Medicare potential impacts on vulnerable North Carolina communities. We further discussed plans to continue our work, update language if needed, and strengthen partnerships with other agencies. The conversation concluded with a consensus to continue our work without diminishing the focus on health equity. The team discussed strategies to improve the quality of life for older adults, considered partnering with senior resource centers and daycare centers in rural communities to provide direct service. We stressed the importance of the consideration of strategies to improve the quality of life for older adults in North Carolina. Furthermore, we all agreed that it remains important to consider these points in our mission statement and website content. All committee members were asked to send further thoughts on language changes and other feedback to Daryl and myself. If you have thoughts that you want to share, please send to us directly, and I can put our emails in the chat. It was also decided that the LGBTQ plus committee proceed with sending out the membership survey on best practices for serving LGBTQ plus community. Everyone, when that goes out, please respond because we do want to get as many responses as possible. The response rate was very low the last time, so we're hoping for a higher rate this time. Health Equity Committee to review and potentially revise public-facing language on the website while maintaining commitment to equity work. Due to the committee's limited capacity, it was suggested that the committee expand the exploration of partnerships with small nonprofits, faith-based organizations, and schools for this work, and possibly consider collection stories. Regarding the need to adjust the public stance on diversity, equity, and inclusion, there was considerable discussion on changing the focus from distinct groups to people and using more general language such as all to avoid unwanted attention due to controversial language and to respect the concerns and challenges of NCCOA general membership. Suggestions included focusing on promoting optimal health for older adults using language like highest quality of life and finding other synonyms for sensitive terms. Members shared examples from other organizations and discussed balancing integrity with funding concerns. The group agreed to gather input from members on revising the statement, which will require board approval. The meeting focused on discussing the impact of recent political changes on aging and disability services. We agreed to continue our work, update our language to be more in line with federal guidelines, and strengthen partnerships with other agencies. The group plans to collect stories about the impact of funding reductions for those most affected and perhaps to engage in advocacy efforts. In conclusion, our work will continue because regardless of language changes, funding cuts, and dismantling of DI programs and services, it is a fact that health inequities persist and the proposed negative effects have the potential to undo years of progress. We will remain strong in our efforts and will count on you to help us to promote optimal health for aging adults in North Carolina. And that is our update from our Health Equity Committee meeting.
Y'all had a
Thank
busy
you so
meeting.
much. Yeah.
I
I'm
see
back
you,
on.
Daryl. Okay,
Oh,
go ahead.
hey,
Yes.
Daryl.
Hey, how you doing? I'm back. I hit the wrong button. You know how it is when you're driving. So Rosalie, thank you so much. So we're about the work and we will continue on. I was glad to hear the secretary this morning and all the questions that were asked. It fits right in with the work that we are doing, and we're all just keeping everything on the radar so that we can make the right decisions as we move forward and meet all the guidelines of whatever we have to do to ensure that our work continues and that our people are served. So Rosalie, thank you so much for giving the report this morning. Does anybody have any questions for Rosalie or myself? I can't see anything. So Mary,
Yeah, I
any
don't
comments?
see any hands up. Yeah, I'm
Okay.
looking. Yeah, I don't see anything.
Okay.
Well, you guys have a great committee and you're always, on top of things and passionate about what you're doing. We can't thank all of you enough for what you do. And, I think you're right. All our work's going to go on what we do. We may have to adjust a little bit our terminology or whatever, but we're going to continue to do what needs to be done for sure. And it was very reassuring to hear the secretary this morning and his.
Yes.
So
thank everyone, all the committee members, the Health Equity Committee members, the chairs of all of the work groups, and I think we will move on in 2025, and we'll have another report in May or June.
All right. Thank you, Daryl. Thank you, Rosalie. Appreciate it. All
right. Thank
You're
you.
welcome.
Okay. Yep. Okay, we're to the point on the agenda for sharing by coalition members. I know this is the season for conferences. I was looking at the calendar that was in the newsletter, and there in the next 3 weeks, there's a lot of stuff going on. So people are going to be really busy. But does anybody have anything particular you want to share that's maybe hadn't been talked about before particularly? Or you want to remind people of anything?
Hey, Mary, it's Heather Altman. Hello.
Yes, ma'am.
And I will put something in the chat. I'll put it in 2 different ways. there's so much going on in the government. I don't know if this will be exciting, but for the second year in the row, we did get Governor Stein, it's a Friday. Governor Stein did proclaim April as Healthcare Decisions Month. We just found out yesterday. We did get the proclamation. So for those of you who are doing education or outreach around advanced healthcare planning or other conversations around end of life or helping around serious illness, I will also put the link and I'll send that out, but did want to share that. But I should stop talking because I don't even know who's in office right now. Thank you, Governor Stein.
I think you know. Yeah, this is a good opportunity for local folks to invite people that have expertise in these healthcare decision making to come and do workshops and to educational sessions, things of that nature. So that's great. We're glad he proclaimed that.
I want to jump right in there since it's Janice. Can I jump?
Yes, ma'am.
Hi, y'all. Since Heather just spoke, because she didn't mention it, and I feel like we should mention it. So, some of you show called Aging Well Together.
And tell them where you are, Janice.
Huh?
Tell them where you are.
I'm Janice Tyler. I'm the director of the Orange County Department on Aging. And I'm also here representing the North Carolina Association on Aging. But this is about home. So Heather is our radio show host for the Aging Well Together radio show. And you can access all those shows through our website. But we have won the SGS, the Southern Gerontological Society's Media Award. So we, the two of us are going to Birmingham to get our award next week. So we're excited. So just thought, I don't know if I should have announced it now or waited till after SGS, but yeah, we're pretty excited. So
That's
just
great.
wanted to share that.
So do y'all have recordings up that people can listen to?
Oh,
74
maybe-
of them. They're
Well, maybe
our radio show we record and turns into a podcast. And so if you go to the orangecountync.gov/aging, and you'll see a button for the Aging Well Together radio show. And a shout out to those of you who are social workers. Our show that was posted yesterday that was for Social Work Month. And so you'll get all kinds of things. And if any of you are not too far away from Carborough, we're moving into our new studio in a few weeks in the new Carborough, the new Drakeford Library, and would love to interview you on the air.
I'll tell you what, I know what
And
he's
I'll
doing
put the
like I
link out.
do. I started saying, I know you're doing a press release about the awards. Send us a copy and we'll make sure that makes the newsletter, as well as send us a link to one of your shows that we can include for people to check you out. That's
Thank
great.
you guys for indulging us.
All right, Kevin Robinson with SHIP, I saw you.
Hey, Mary, thank you. And congratulations to Heather and Janice. That is great news. Today, I just want to share on behalf of the North Carolina Partnership to Address Adult Abuse. I'm putting a little message in the chat feature that we're having our conference May 20th, 2025. And we have some room for 10 agencies to have a booth to be a part of the conference as well. So I just wanted to mention that and have you to refer to the chat to save some time.
Kevin, I know, thank you for that, and hope people will attend. It's always a good conference. I know at the last meeting, Melinda talked with us about the real uncertainty regarding funding that you guys at the SHIP program were facing. I believe there's been an update on that, and you want to say anything about that?
Sure. Yes, we actually, with the continuing resolution, we are receiving our funds. I know for our SMP program, we're going to get about 17,000 to 17,600 less than what we received last year. For our SHIP funds, because of the timing of the continuing resolution, we're getting 30% of our SHIP funds for the coming year, April 1st. And then hopefully soon after that, we'll be receiving the rest. It was just the timing of the way the continuing resolution happened is the reason we're just getting the 30% now. And MIPA was also reauthorized for another year, for 1 year in the continuing resolution. So we're happy about all that. So right now we're looking okay, but we're just, still with the news of yesterday with ACL's information that came out about ACL and being possibly split up into different areas. We're waiting to hear what's going to take place on that, because I know our SHIP program, we were housed under CMS at one time, but we feel we've had so much better partnerships with the folks at ACL, and it's been a positive thing for us to be able to even look at the full data that we're looking at across the country. So we're hoping that of what's going to take place, we'll just be on the lookout of what's coming down when we hear. So
Okay,
thank you, Mary,
great.
for
Well,
asking.
great news. I know maybe a little anxiety has subsided there. Let's hope.
Yeah.
Let's hope so. Say, Dick, see your hand next.
Okay, I'm on here. First of all, I want to congratulate Heather and Janice, my neighbor, for the award. And secondly, to congratulate Sandra for the latest newsletter, the update, because it's got a lot of really good advocacy information on now. And I just hope everybody will take advantage of it. And please make your voices heard. You know, this is a crucial time in Washington for people behind the scenes to be gutting Medicaid and even Social Security. So I hope you will either, as individuals or groups, call the offices of the senators and your congressman. It's easy to find out who it is. And if you want to get a little more advanced, most of the congressmen have several counties, so get one person per county and make a Zoom call. They don't want to have town meetings, but they will talk to you. And just kind of remind them about the nursing homes in their district, because Medicaid means nursing homes. That's it. And so it's just a polite way of letting all of the people know that you are watching them, even though they're not actively involved, but you want to put it away. So I wish everybody good luck with that.
So Congress is back in. Thank you, Dick. Congress is back in, will be for a couple of weeks, and then they have another break around Easter time where they will be home. I know that a lot of them are going to virtual town halls instead of doing in-person town halls. So consider joining those virtual meetings if they aren't doing in-person meetings where you can make your voices heard too. And it is important to contact their offices, even though you're probably going to, if you're lucky, you'll be able to get to a staff person. I'm finding more and more of them, you're having to leave messages on the answer machines, but they all take tallies of people who call and what issues you're calling about. So it does make a difference. Just have all your friends and neighbors call too, you know. They are numbers. I'm not seeing any more hands. Anybody else got anything for the good of the cause? All right. Well, any other issues that anybody wants to bring up about anything? Just to remind you, a little forward thinking here, our meeting in April is going to be the usual time during the month, but in May we do have it a week earlier because of Memorial Day weekend. So just note that on your calendar also.
And even though it's a little bit further in the future, we have our annual meeting is going to be on September the 26th. And it's going to be at the Hilton Garden Inn as it was last year. So let everybody get that on their calendars.
All righty. Well, you guys get a whole, like 21 minutes back today. So enjoy it. Get outside and take a walk. Make a phone call to your congressman.
Yeah. Thank you,
All
everyone.
right. Take care, y'all. Have a good one. Bye-bye.